Next, we are joined by Steve Krein, CEO and co-founder of Startup Health, a global platform to accelerate health and foster innovative startups. Startup Health and its founders, Steve and Unity Stokes, are longtime friends and partners of the mHealth Summit. We are pleased to have them back this year and more active than ever. They joined as the lead strategic partners of our Venture Plus Forum, which took place yesterday, where they led a panel on healthcare business model innovation, and they are the lead anchor of our Innovation Zone, which will showcase over 80 emerging tech companies transforming healthcare delivery. The theme of innovation and the transformative role of technology in healthcare is a cornerstone of this year's summit. Today, we are pleased to have Steve lead a dialogue around the reimagination of healthcare. He will offer his thoughts before being joined by Steve Case, co-founder of AOL and CEO of Revolution, and leading angel investor Esther Dyson. Please join me in welcoming Steve Krein.
Wow! I feel good.
Good morning. Thank you for coming out this morning for a snowy and treacherous ride down or up to Washington, but we are incredibly excited about this year's mHealth Summit, not just because this is our third year attending what has now become the industry standard as it relates to conferences around mobile health, but it really sets the backdrop perfectly for what we're going to talk about this morning, which is truly the reimagination of healthcare. An entire industry about to go through, or in the beginning of going through, its creative destruction moment. As Steve mentioned, my name is Stephen Krein, and I'm the CEO of an organization called Startup Health, which is a global startup platform designed specifically to accelerate health and wellness innovation. And what we figured out over the past several years is that there's actually a formula to the reimagination of healthcare. It's something that we like to call healthcare transformers times the network effect equals the reimagination of healthcare. And when we say healthcare transformers, what we mean is the entrepreneurs and the innovators who are completely reimagining the way life is going to be over the next 5, 10, 15, and 20 years. We believe that when you take all of these innovators and entrepreneurs and you network them together, and you network them together with customers and partners and investors, all with a similar vision of transforming healthcare, anything is possible. Before I kind of dig into this reimagination formula, what I wanted to do is tell you a short story about an experience I had earlier this year after taking a test with the spit test with 23andMe, which has been in the press a lot lately, but what's been interesting is there's a little part of 23andMe rarely people talk about, which is an ancestry page. And on that ancestry page, there's a link to other people that have a similar match around your DNA. What I found when I logged on to 23andMe for the first time earlier this year was that I have a potential second or third cousin, someone I had never even heard of. So I reached out to him and sent him an email, and I didn't hear back for a couple of months. In early April, I received an email from him. His name was Ben, and what he then went on to tell me, and he had his mother on the phone, was that I was actually, and what I found out, was his second cousin once removed. These are actually my great-grandparents. I had never, ever seen a picture of my great-grandparents before. In fact, my 81-year-old father got to meet his first cousin for the first time, specifically because of a technology that didn't exist 5 years ago. My 81-year-old father's father came to America in 1922, literally with no family. My father didn't have a cousin, an aunt, an uncle, or a grandparent until 23andMe's spit test brought us together, not just to tell us about our family history, but to connect long-lost relatives, to truly share a future together. Today, there are literally thousands of startups reimagining every aspect of healthcare, just like 23andMe. and Gene by Gene and 1EQ, these genomics companies that are completely transforming the tools that we have to transform healthcare. And I'm so convinced that this is the moment that we're going to see a decade where this industry will look completely different 10 years from now. And I'm so convinced of it because there's a simple model that Joseph Schumpeter designed or coined about 75 years ago called creative destruction. And it looks something like this. Every single industry goes through these stages. There's an emergence of a new industry. People doubt it. People start to invest a little bit. Entrepreneurs lead typically this phase of a market. And then an entrepreneur leads it through to it finally becoming a growth stage, a status phase, and a depleted phase. This starts to look familiar. At this moment, an industry gets completely transformed. This is creative destruction in action visualized. Now, we've seen other industries get transformed over the last 30 years, 40 years, media, entertainment, music, travel, retail and commerce. But there's two industries, education and healthcare, which have yet to be transformed the same way every other industry has been transformed. And this is the backdrop for what's going to be a conversation this morning with two people who for the past 30 years have led and participated and convened in creative destruction moments for other industries. And it's going to prove to you today why you're sitting at the beginning of an epic decade of transformation. So, there's 4 conditions that make this moment different than any other time in our history. Literally any time in our history. And if you think about healthcare right now, you've got healthcare reform, and with all its press lately, it's an instigator of change. You've also got chronic disease and aging, and costs accelerating out of control, combined with the fact, hence this conference, that there's mobile health and digital health emerging and being adopted at a rampant pace. An iPad mini, which didn't exist 2 years ago, or an iPad that didn't exist 4 years ago, or sensors that now cost less than 10 cents, that are completely transforming the types of tools and the amount of data that we have. And finally, and this is the clincher for the whole entire thing, we're living in the golden age of entrepreneurship. A moment where it's cheaper and faster to be an entrepreneur. And new types of entrepreneurs are emerging. Doctors are becoming entrepreneurs. Today, we're sitting at the beginning of this epic decade. When you look at healthcare reform, and regardless of what you read, it's expanding market demand. It's changing payment models. There's downward pricing pressure, and it's disrupting long-standing market structures. And finally, employers, large and small, are completely rethinking their benefit strategies. On macro trend number 2, the cost problem. We know the numbers. Almost $3 trillion a year is spent in the United States. It's 18% of our GDP. We spend more than so many other countries that have so much better health than we do. And we know that chronic disease and aging and hospital readmissions are not the place they need to be. And finally, there's an upcoming physician shortage. We're going to be short by 130,000 physicians by 2025. And then as you'll see today and tomorrow and Wednesday, you're going to see example after example of mobile and sensors and other technologies that are completely transforming the tools that we have. The availability of mobile, the adoption of mobile, the convergence of open data with mobile and technology, and the rise of the empowered consumer. And finally, the adoption by the government and by large organizations around mobile health. And then we wrap up with healthcare transformers, the entrepreneurs. For any entrepreneur who's ever tried to transform an industry, I can assure you there's no tougher industry than this one. But the rewards are incredibly important. The stakes are high. But thanks to a shorter life cycle to take an idea, to become a product and a service, to get validation, to look at lower costs for user adoption, lower costs to build a company, instead of it being tens of millions of dollars like it was when I was an entrepreneur starting my first company in the 90s, or as you're here today, like Steve Case starting a company in the 80s. When you look at the access to capital angel investors, foundations, corporate VCs funding these startups, and you look at the efficient access to accelerators and angels and experts. I mean, when I was an entrepreneur in 1996 starting my first company, there was a book called Startup. That was about all we got as it comes to expertise as being an entrepreneur. Today, there's incredibly efficient access to expertise. So let's go back to this formula. Healthcare transformers times the network effect equals the reimagination of healthcare.
The interesting part about participating here was really coming and keeping our finger on the pulse of what's going on within the industry, seeing companies from all different parts of the healthcare sector.
mHealth is the epicenter of all the action, brings everyone together. It was good to pitch to venture capitalists, investors, angels, all that stuff, so it was great.